Welcome to Mum Days, a beautiful collective of mamas and experts sharing wisdom, inspiration, and life hacks to support us on this journey through the hazy days of motherhood.
Welcome back to the Mom Days podcast. I'm your host, Holly Lowe, and joining us today, my favorite naturopath, Dr. Danielle Marchildon. We are going to talk the mysteries of estrogen. And I am hanging out in my hat and my cozies today because I am up north and it's minus 34, everyone. Just wanted to let that sink in for a minute so you can feel sorry for me for just a second. All right, we're good. Okay, so welcome, Dr. Danielle. She is a licensed naturopathic doctor in Orangeville, Ontario, actually, where near where I used to live. And that's how I had connected with her years ago, actually, when I was a business owner in town. And she co owns her own, I guess, you co own with someone else your own clinic called the Collective Health Clinic. I'm sorry, that was not in my notes at all. And you are a proud mama of five, which I adore as well. Your kids are super cute. And I love about your practice is that while it is a family practice. I know we've
Mm.
chatted kid stuff and all of that, but you have a real passion for women's health. And that's what we're doing right now. The whole thing we're focusing on is from, right before we're even talking about fertility and having kids, right through to having babies and right into perimenopause and menopause, because it's the whole gamut, right? So, welcome. Tell me a little bit about why this is a passion for you.
Sure. I think, graduating from medical school, the focus always, and coming to Orangeville, which is a smaller town, the focus was always sort of a family oriented practice. And I think as I kind of moved through, I didn't specialize and I still don't in a way, but I think I just pull a certain demographic to the practice. And I think it potentially comes out in my passion or when I'm speaking with patients, but women's health has certainly brought itself to the forefront. Fast forward, I graduated in 2008. So fast forward to about 2015, and the Ontario government so very gratefully gave us prescription rights. And in that prescription right was bioidentical hormone therapy. So this took my knowledge of women's health, women's pathology, women's journey through life to a whole new level in terms of looking at perimenopause and menopause, for example, as a diagnosis versus just something that naturally happens to every woman. Um, and then as I started treating, that's when I started to hit resistance around the idea of hormone replacement, not only around the idea of hormone replacement, but around the hormone estrogen to begin with.
Right.
So I quickly started to hear in women's voices that, or their stories that what they had been taught was that estrogen was bad, right? And we are kind of learning to fear it in a way.
Mhm.
So now I have, and I have three of my children are female, and two of which are now entering puberty. And I've heard them mirror statements. Here's two young girls
Ah,
just on the brink of puberty, and they're like, "Well, I guess my estrogen's kicking up," and what do you mean?
I thought it was just my daughter. Okay, so it's not just mine.
No, but then like at 13,
Yeah.
my one daughter is already just from, I mean, I've talked to them about biology, their anatomy, what's happening, and like, oh, you're crying for no reason. Let me give you a little bit of a reason why,
Yeah.
right?
But what does mom know? I mean, really.
Well, that's the other thing. It
Right.
would come off a lot better if it wasn't for me. Anyhow, and yes, my husband going, this is what she does when they're looking at me like, get on with it. Anyways.
Yeah.
Uh,
Totally get it. I
Yeah,
understand.
yeah, it's a really fun dynamic. Anyhow, yeah, I just found it really shocking that my 13-year-old daughter, who I felt like I had given a very unbiased, very realistic sort of backstory to what was happening, she somehow picked up in our culture alone that estrogen was making her feel or was the culprit in the
Yeah.
unpredictability of emotions, right?
Yeah.
Um, and I think what I'm trying to do is get women to fall in love with estrogen again because man, we miss it when it's gone,
Yes.
right? Right?
Yeah. Yeah.
That it's something we do. It gets a bad rep because, and I'm a very evidence-based naturopath, so I like to stick to around evidence and there's terms like estrogen dominance, which isn't really it's not in our like our DSM, our diagnostical and statistical manual. It's a theory, it's a very functional theory as to why some women may have issues with uh, quote unquote too much estrogen, but as a diagnosis itself, it doesn't really hold any ground,
Interesting.
and it connotates a very negative energy with that, right?
Yes,
Mhm.
absolutely. Well, and the idea with any balance of hormones is the balance, right?
Absolutely.
It's not just estrogen, it's not just progesterone, testosterone. Like we've got a whole, slew of hormones that are actually working together in our body.
Yes.
And I mean, we've spent a lot of time in the podcast and over time just talking about gut health and how the production of hormones is affected in there. And then talking about, how we just care for our stress levels and our cortisol and
Yeah.
there's so much. So to
Yeah.
have estrogen always be the bad guy, I
R
think
exactly. Exactly.
that really is what it's been. Even growing up, I remember my mom had a hysterectomy when
Mhm.
I was 7, I think.
Mhm.
And I remember it was pretty dramatic in our house for her to have to go through that. And going through some of those symptoms afterwards, it wasn't a full hysterectomy, so she did have time in there.
Yep.
But I remember for years hearing talk about estrogen with her, and this is way back when, right? We're talking
Yeah.
70s, 80s, 90s when, that's all I knew about
Yeah.
perimenopause and menopause was early for her.
Sure.
But I also that's all I knew was it was estrogen. Estrogen was the bad thing. It was terrible. It was wreaking havoc and it was driving her crazy.
Yes.
And yet you're right, it's still the story.
Yeah.
I haven't seen much of that change. I've seen more talk about self-care. I've seen more talk about gut health. We're starting to catch up with women's health and,
Yeah.
you know, we have a long way to still to go
Yeah.
in respect to women's symptoms and our, what we actually know our bodies doing.
Sure.
But what do you think is there a culprit behind that? Is it just generational? Is it just historical that this keeps going? Or is it like I hear soy, we talk about soy all the time.
Yeah.
Soy and estrogen,
Yeah.
we had some funny I'm gonna throw this in just for fun. We had some funny ones with lavender oil because that's what I do.
Right.
Over years ago, one particular researcher did a study with 2 boys. That's it, 2. And
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 boy,
one of them happened to have grow man boobs, I guess. What's the term? I have no idea. Breasts, but slightly larger breasts, and they attributed it to lavandin. But then, like 10 years ago, went back and went, no, that entire thing has been debunked. It's a complete joke. That wasn't the issue at all. It
right.
was soy. I'm like, hold on, back it up. Now you're
Amazing.
just throwing one under the bus after another. So it's a funny one for me because I think, okay, we're just going in circles.
Yes. Yes.
Where is this coming from? Is it any of those things?
I think like for when I talk with other practitioners, whether they're medical, medical doctor, a Chinese doc, a homeopath, it doesn't matter, whatever their background is, if they haven't kept up to date with current research, they're all holding on to the 2001 Women's Health Initiative study that took a demographic of women, administered a form of estrogen as a form of hormone replacement. And they quickly stopped the study because they noticed some women were developing breast cancer.
Ah,
And the conclusion was made that estrogen hormone replacement causes breast cancer.
interesting.
There was a the study itself has been largely debunked, like largely the
Yes.
amount of flaws coming out of this
I
study
heard
is
that. Okay.
it's incredible.
Yeah.
And as soon as, it sort of, and then it was like the first domino. So as soon as that first flaw was found, it started to ask a lot more questions, which is where all the
Right.
other flaws just sort of compounded. But then it was like, well, okay, so wait a minute. We don't actually have any idea what estrogen is doing as a tool for hormone replacement. So it has stimulated since 2001 all of the studies which are showing the opposite, which show a
Mm,
huge safety profile with estrogen. I still have family doctors in town who continue the stigma or the fear around hormone replacement. And these are women who their depression and anxiety are so heightened. Their hot flashes, don't allow them to sleep. They are on leaves from work because their hot flashes are so severe, it's embarrassing. The
Wow.
vaginal dryness is so bad that it's now causing bladder irritation and prolapses, and they no
Right.
longer have intimacy and joint pain and heart palpitation. Like the list that we can now attribute to menopause and the degree to which it affects quality of life, I
Mm,
can't. I no longer sit back. I can't. I'm starting to fight
yeah.
back, right?
Yeah.
So there are
Well,
more
especially
like,
when you know, right?
"What?"
When you know there's hope. It would be like us telling a friend who is struggling with, I don't know, bipolar or something like that, that you know there's treatments for, and
Yeah,
telling them it's all in their head. You know,
yeah.
like, no,
Or
there is actual treatments for this. Yeah.
my favorite line from a family doctor was just do what your grandmother did. Push through. Push through. And
Wow.
this patient, she
Wait,
was
man,
in
was it a
tears.
man?
It was.
Yeah.
It was. So I had to write a letter. This is where I'm biting back now. And
Mhm.
everything I do is transparent to someone's primary care
Of
physician,
course.
right? Hormones are a prescription. If I'm writing a prescription, and of course I get consent from the patient, but I like the family doctor to be on board and to just to know what we're doing. Um, and in this particular case, I needed so there's just a with my prescription license, I can't prescribe oral progesterone. I can prescribe the same tablet as a vaginal
Right.
suppository. I just can't write it as oral. So for this particular patient, I was asking the medical doctor to write a prescription for oral progesterone,
Right.
and he refused. Mhm.
Wow.
So this is, I mean, he wasn't the only one. I've had it several times.
Really?
Yeah, I've had a family doctor call my office and say, "Well, I don't know what this is." What do you mean you don't know what do you mean you don't know what this is?
Red flag.
Yes.
What?
So I had to explain what the and this is
Wow.
a prescription. I mean, it's still a bioidentical form of progesterone, but it's still a prescription. So I explained it to him. I explained the roles. I pointed him towards some PubMed ID numbers just so that he could look that up. And he gave the prescription.
Yeah.
Um, but otherwise I'm writing letters and I'm very professional, obviously, but I just, with all due respect,
Yeah.
we no longer are required to push through this, right? That
Amazing.
it can now be pathological. Yes, it is a normal process that every female will go through, but the degree to which it affects our quality of life, there can be pathological states in there, and that does require treatment.
Yeah.
Yeah.
Wow. And that's, I mean, the beauty of that is you are doing this. Like there's granted, I mean, family doctors are GPs are taught what they're taught. And
Yeah,
like you said, unless they have kept up with it, not all of them do. Some of them are very old school and we know
yeah,
that. I mean, we all have them.
sure.
You do need that. You need some education, right?
Yeah,
So, I mean,
yeah,
that's amazing that you do that because obviously you're going to bat for your patients as well, but it
yeah.
helps teach them a little bit too. You
Yeah.
know,
I
like,
also
come
I
on, get on
think
board here.
Yeah, well, the other thing I find really interesting is their lack of knowledge. Not, and I don't mean to talk generally, but I just see a
Yeah,
pattern where there's a lot of lack of knowledge around the hormone replacement options
yes,
that are out there,
agreed.
right? So, where I've had a gynecologist out of Mount Sinai say, well, a patient who was on bioidentical estrogen from me, saying that she didn't like the plant-based estrogen, so she'd rather her take estrogel, which is another prescription which I have access to, but it's also plant-based.
So it's a lack of understanding of what they're actually prescribing in
Yeah,
essence. Yeah.
yeah.
Yeah. Well,
So
I mean, and that's ultimately how I ended up with you going through all the process we are for fertility and hormones and just sorting out my body
sure,
was just that was my family doctor. I love him. He's fantastic. But
yeah,
he actually said to me, this is just not my area of expertise.
which I totally
And I'm
respect.
like, great. Yeah. And
Yeah,
he said, I mean, I can offer you some options. You can go talk to a fertility clinic. He said, but I don't think you're quite there yet. And I wasn't at that stage. So
right.
it was a great I was a great admission on his part to be able to say, "This isn't really my thing, but,
Yes,
let me help you find something that could or someone who could work with it."
yeah.
I'm like, "No, I got it covered. I'm good."
Yeah, yeah, I know where
You
I'm
know?
going. I know where
Yeah,
I'm going. But that's exactly it, that he was able to recognize that he hasn't caught up with that, and he's not, so go find someone who is,
yeah,
right?
yeah.
And I wish I heard that more. Oh,
Agreed,
I wish.
agreed. I hear it so often just from friends and,
Yeah,
doula clients over the years and other people who just never felt heard. or respected. And it is I mean, whether it sounds general or not, it unfortunately is true. It is a generalization that's true,
Yeah.
that
Yeah.
women in general just don't really have their symptoms respected, or their, what they're actually explaining, they're feeling
Yeah.
treated, appropriately maybe. So, yeah.
No, no, we gotta, yeah, it's time. I feel, yeah, I'm caught between, like starting, like really empowering patients, educating them,
Yeah.
getting them to have those conversations with their primary care physician, but then recognizing the limitations that our primary care physicians are under in terms of
Of
our
course.
OHIP system. And right, like
Absolutely.
we're
There's a
asking a
backstory to all of
lot.
it. Yeah.
There is. We're
Yeah.
asking a lot of a system that maybe just doesn't have that option. So that's where I try to bridge it.
Yes.
I try to bridge that, right? I used to hate uh, uh, angering medical doctors. Like I was always tiptoeing around,
Yeah.
but now that, I mean, I've been in practice for 14 years now. I've got the ground beneath my feet. So now, while it is always professional, I'm no longer scared. Like I feel
Yeah.
very confident in the approach that I think is valuable and is backed by evidence that,
Yeah.
yeah, I'm not tiptoeing anymore. It
That's
feels,
amazing. Good for you.
yeah, it feels good.
You should. You know what you're doing. I love it.
Yeah, yeah.
Okay, I want to know, because you mentioned it briefly, and this is something that was complete news to me. It was actually my older sister.
Okay.
She's 6 years older than me, and
Mhm.
she's on a lot. We do podcasting together as well. And she's the one who brought up to me one day when I was having some weird symptoms, and out of the blue, and she's like, "Well, those are symptoms of menopause." Ha ha. And I went, "They are?" So, like, like she was bugging me, but I'm like, "Wait a minute, are they actually?" And she's like, "Well, yeah, they are." I had
Oh.
no idea. So go through that list a little bit. I mean, I'm sure there's a lot of them, but what are some of the main ones that are? And I know perimenopause is part of that, so you can explain that maybe. But what are some of those things that we might not even be thinking of beyond hot flashes?
Yeah, excellent question. Because I think a lot of women, aside from no period and hot flashes, and I see it all the time where I'll get a woman coming in, say, with um, uh, joint pain that wanders, and no one can help her because the x-rays look normal, her blood work's not showing anything. She's just been told to take Advil on her bad days. And then when I track it back to, well, how long has it been since you've had a period? And I find out it's been 14 months, right? So when I say that's menopause, it shocks her
Yeah.
that giving her back some hormones will alleviate the joint pain, right?
Wow.
So there are some really weird symptoms that we don't usually attribute to hormones, but it does speak to when I say that, we need estrogen.
Mm.
We need it, right? Um it is a female's vitality.
Yeah.
Okay.
Yeah.
So in that sense, yes, hot flashes. So the drop in estrogen will create a vasomotor effect, right? Where it's actually a blood vessel reaction that's happening. It's looking for the estrogen, can't find it. We see an LH, a luteinizing hormone surge from the brain, and that pops our temperature up. Aside from that, though, right, the list is long, but the ones I see most commonly is definitely unexplained joint pain,
Interesting.
a worsening or a new onset of anxiety or depression.
Hmm.
Brain fog's a big one, and poor memory. We can see hair thinning and then loss of tone to our face and our skin in general, right? So, I mean, as we age, we're all going to start to have wrinkles. I have them myself. But
Stay
when you're,
away.
I know. But when the period stops, then it will get significantly worse fast, right?
Mm,
Bone health, of course, right?
yes.
When estrogen levels go lower, it starts to leach calcium from the bone. The other part that I think is really big for my practice, because a lot of women, one, are either scared to talk about it, not sure if it's the right place to talk about it. It's the vulvovaginal area.
Hmm.
Right? So vaginal dryness, recognizing that our urethra, or the pathway of urine, is right next to the vaginal canal.
Right.
So anything that affects our vaginal canal can also affect our urethra. So we see
Yes.
an increase in bladder infections, painful intercourse, uh, we can just see like a vaginitis where it's very itchy and inflamed. And then these poor women are being treated repeatedly for yeast infections, and it's not even a yeast or BV, and it's
Yeah.
neither of those things, right?
Ah,
It's just that irritated,
yeah.
awful, wreck your intimacy, wreck your quality of life, vaginal dryness. So even and like fixing that piece, uh, fixing that piece alone, aside from all the other symptoms, uh, has been a game changer for so many
I
women.
can
So
imagine.
something I ask, right? If they don't offer, I'm still asking because I know that it's more of a sensitive subject, and recognizing how it can, like, it really can affect quality of life,
Yeah. Well, and
right?
I think again, it's one of those things that we as women tend to brush off too,
Yeah,
right? It's like pregnancy and birth symptoms and things like that that we're like, whatever, it's just part of it. And you're like, well,
yeah,
hold on, no, it's actually can be fixed. We can do something about this.
yes. Or
So
being, women being told like this is your sex life. It's gonna hurt. You might tear, so
yeah,
don't do it. Or use, the whole conversation of lubricants. But
yeah,
what if there's something we can do that doesn't make you dependent on lubricants and doesn't make you
right,
hate it
yeah,
or fear it too?
yeah,
Like that's right.
absolutely.
Yeah. That's also that's a huge piece for me is
That is a
seeing
big.
that improvement. Oh, there's just
And when
change.
you see, so when you see women who are experiencing some of these, I'm assuming it's not one symptom. You're usually getting a few of them,
Yeah.
right,
Yeah.
combined,
Yes.
or come and go, or whatever that looks like. So, what would be your first step to say, okay, we're gonna take care of this? What would you be doing some testing? I mean, I know with you, we did for myself, I did the Dutch test for the
Yep.
hormone panel. I don't know if that's the same kind of thing you do for this, but what would be the
Mhm.
first step?
That's a really good question because it depends on like testing in perimenopause and menopause. I don't do a lot of
Yeah,
because if you're perimenopausal, which by definition are the years leading up to that very last period, so we can see heavier bleeding, we can see more infrequent periods, we can see development of fibroids, we can see long-standing periods of bleeding. I know what those hormones are. Well, I can guess based on where you're at what those hormones are going to say, right?
right.
If the hormones look good, then you got blood taken on a day that your ovaries decided to cooperate, right?
Exactly.
If
Yeah,
your hormones look bad, it just means that on that day, your ovaries weren't cooperating, right?
yeah,
And then once we get to a whole year without a period, I know exactly what those numbers are going to say, right? So I do a lot of testing in my practice, but I do it to learn something I don't know already,
right.
or if it's going to change the course of treatment.
Okay,
If a female hasn't had a period for 12 months, course of treatment isn't going to change whether her FSH is at 40 or 45.
that's what I was curious. Okay, so
Yeah.
would there have to be like a massive imbalance of weird, weirdness going on for you to go, oh, we need to change that or check that? But in
Uh,
general, it's going to be around that.
well, sure. And I think what we have to take into consideration here is the woman's age. So if you're 39 or 42 and you come to me and say, I haven't had a period in 9 months, I'm going to check on blood work because I want to make sure it's a little early to have complete cessation of period,
Right,
or even to not have a period for 9 months. That's a little early. That's when I'll check in to make sure it is, in fact, menopause and not elevated prolactin.
right,
Right. But if she's 52, with no with leading up to regular periods her entire kind of reproductive time span, I probably won't check and I'll start treatment. My most effective tool is hormone replacement,
right,
hands down most effective tool. So the first thing I want to do is rule out or in whether or not the female is a candidate for hormone replacement,
right.
right? So I mean the biggest contraindication to hormone replacement therapy is a history of a personal history of blood clots
Okay,
or a clotting disorder,
yeah,
right?
yeah,
Um, bioidentical hormones, we actually see a really good safety profile. The blood clotting issue is more around birth control pills,
right,
which is a synthetic form. It's a progestin, a synthetic form of estrogen. But we're talking blood clots, not a sore thumb. So
yeah,
we err on the side of caution, and it's just a complete contraindication. Also, in Ontario, if the patient has had breast cancer, it is also a contraindication. There is some studies as well that will say if they have a primary relative who has had hormone receptor
Interesting.
positive breast cancer. Yeah, there are some really interesting studies happening overseas looking at using hormone replacement as a treatment for women who have undergone either surgical, so they're in surgical menopause, meaning the ovaries have been taken at a younger age, or who are in remission from breast cancer and are on medication. It's a medical menopause, right?
Right.
Or a pharmaceutical menopause, using hormone replacement to improve their quality of life with that
Mm,
is not showing an increased risk of reoccurring breast cancer.
yeah.
So there's a lot of work going on around that right now. So far, the studies look really positive, and I'm really excited about this.
Good. That is
Oh,
exciting. My mom's a breast cancer survivor, so that's one that both my sister and I are always like, okay, we want to stay on
ooh,
top of what's happening with studies and what's going
yes.
on. And interesting enough, she's just a very, I mean, she's our mom, so she doesn't stand a chance, but she's she's a very natural minded woman. I should finish that sentence. Uh,
Well,
she's
you
just a
guys have
very
to go from
natural
somewhere.
focused woman, right? So I
Yeah.
mean, even to have done, she did chemo and radiation, but she cut her chemo halfway. She was like, "Nope, I'm done. This is making me so sick. I don't want it anymore." And she stopped.
Oh,
And her specialist was like, "That's fine." She goes, "If you were my mom, I'd say you're good. Go ahead, move on to
oh,
the next part."
yeah.
And then radiation has left her with so many issues. So she just was like, "Okay, I'm not doing any of this." So she hasn't taken any of the hormone replacements they want her on, all these other things.
Yeah.
She has worked with a great naturopath, and she's done some other things, and she's thriving in
Oh,
spite of it all. And it's been almost 5 years now.
wow.
But anyway, it was that always comes up in my head when I hear estrogen talk because I'm very hyper aware of our breast health and cancer in our family and things like that. So
Yes, of
yeah,
course. That will
yeah,
do that. That will do that. Yeah, yeah, yeah. It's a loaded breast cancer is a loaded
yeah. Well, that
diagnosis.
was the first time I heard estrogen dominance talked about.
Oh, okay.
And it was interesting to have those. Her specialist was beautiful. She let me ask a million questions at every. I would go to every appointment. And
Yes,
she's like,
amazing.
"You know what you know. I know what I know. Let's just chat." So
Yeah.
she's very patient to answer my questions, especially. So yeah, it was interesting to hear some of those estrogen conversations too, and have her explain some of these and what
Mhm.
does all this actually mean. And she was a great one to say, estrogen's not bad.
Yeah.
And I'm like,
Yeah.
oh, good. That was honestly the first time I'd heard a doctor say that.
Yeah.
Yeah.
Good. Yeah. So she's up to date. That's good.
Yeah,
That's
yeah,
good. Yeah.
yeah, and there's hope. There's some
Yeah.
doctors out there who know what they're talking about, but yeah.
Well, and I think, yeah, the other big piece here too, with regards to hormone replacement and what kind of a role estrogen can play, we have these, we have to remember that, women, when you look at statistics of what women are dying from, if you compare breast cancer to heart disease, it's like 100-fold. So in I think between the ages of 60 and 70, in the States back in 2014, which is I think the most complete list of stats I have, I think roughly 12,000 women had passed from breast cancer, but 163,000 had died from heart disease,
Wow.
right? So
Yeah.
culture has us hyper vigilant around, which is great. I'm breast screening, right? All amazing. We have the tools. We have our own fingers and our own
Mhm.
awareness of breast tissue. That is incredibly important, and we still have to do that. But where is the conversation around what we can do to prevent heart disease? That yes,
Mhm.
there's really obscure dietary advice out there. Yes, we all know we got to move our bodies. But what about presenting women with the study that if you do any time with hormone replacement, it could be a month, it could be 10 years, it drops your heart disease risk right out.
Wow. I
Same with
had no
Alzheimer's.
idea.
Same with Alzheimer's, same thing, drops your risk right out.
Interesting.
So much so that we have repeated studies that show that women on average who use hormone replacement for any time live, it's an average, up to 7 years longer than women who don't use it,
Incredible.
right?
That's amazing. Yeah,
Yeah.
I would never have known that.
There's one of the compounding pharmacies here I use in Orangeville, there's a man who, like, and as soon as I hear it's a man, I think they just need to stop talking about, I don't like, just stop. Don't give me stop. Anyways, a male pharmacist, and I had a patient going in, and we were reducing her hormones because I have women who usually it's because they've retired and they don't have the same drug benefit coverage. So we want to try and find a lower effective dose just from a cost perspective. Anyhow, he noticed that she had had a reduction in her prescription, and his opinion was that this was the secret. This was, hormone replacement, these bioidentical hormones is the anti-aging secret. It is the fountain of youth. And then he said, if I were a woman, at which point I'd be like, stop. Anyways, he kept going. If I were a woman, I would be on these things till the day I die. I was like,
Wow.
too bad you're not a woman.
That's right.
But he's not wrong,
I mean,
right?
he's on the right track. Yeah. Yeah.
He's not he has looked at current evidence, right? We have this really amazing safety profile. We have an amazing safety profile around the length of time a female is on it. So it's not like, unlike the pharmaceutical option, there's a pharmaceutical product called Premarin,
Yes, I've heard of it.
which is an estrogen that they source from pregnant mare
Yep.
urine or horse.
Yeah.
Yeah. It is exponentially more potent than the human hormone.
Mhm.
Okay. So I have medical doctors who will take a female who's really struggling and they'll say, I'll give you Premarin for 30 days. They don't want her on it. Premarin is what was used back in 2001 in the Women's Health Initiative.
Gotcha.
It does have a better safety profile than that initiative showed.
Right.
However, there are better, more effective options out there.
Yeah.
Um, I lost my train of thought. I'm not sure where I was going with that. Not too bad.
That's okay.
Alright,
That was
alright.
fascinating.
Great, great.
But one of the things that I think is important to note is that if you're not getting a solution, or if you're not getting where you need to be, there are other answers. There's other options, and we've
Yeah.
come a long way,
Yes,
right?
yes. We've come in like it's incredible what we have. Like I am so grateful that I'm going through menopause in this time versus like my nana who
Yes.
never said a word, like not one word. And then I think she must have been in her own, that must have been torture.
Right?
Like talk about like no wonder this whole idea of hysteria. Like you feel
Yes.
like, so
Yeah.
you don't say anything because you don't want anyone to be like, oh, she's just some crazy female,
Yeah.
right? So I
They
just,
used to institutionalize women,
yes,
right? And we always joked about this. I remember going through some of my trainings and stuff, and I'm like, I guarantee they were all in menopause. They were either PMSing or they're in menopause, and they just said too much.
yes.
You know,
I can't. But then now, yes, I just got, and it has brought the number of times I've seen this conversation or just educating the female, it has brought her to tears because she just feels human again, right? That she is not choosing to feel this way. It's not all in her head.
that's right.
There's something we can do about it. Yeah, it's why I get up every day. Like
I love
those
it.
moments, it's why I'm here. It's why I'm doing what I like. There's nothing that compares,
I love
right?
it. Well, and I can, on a small scale, can understand the feeling of that. Like even just being able to look at some of my hormones and say, in the work we've done, and be able to go, oh, I'm good. Like I'm
Yeah,
good.
yes,
Everything's good. There's nothing wrong with me, because you can very quickly make up all these other stories and tell yourself this
100%.
whole other narrative about,
Yep.
I'm just crazy. I'm just this. Maybe it's this. And then you Google it, and then you,
Oh yeah, yeah,
like, I'm
yeah.
dying now. I don't know what's happening.
Yes.
Oh
I've
my
got a
God.
month. I've got a month
And
left.
it's just, it can become a much bigger story than it needs to be in reality, or you just end up, like you said, internalizing it, and
Yeah,
you carry this stress, and it
yeah,
accumulates. I mean, we did a whole series just on what trauma and stress does to your physical body, and how that
absolutely.
accumulated, repressed feelings, all those things can just wreak havoc on top of what you're already dealing with. So
Yes,
it's
yes.
an
Well, and
extra.
that whole God, it's so fascinating. That whole conversation around stress and inflammation, right?
Mm,
Like that's I'm on a tangent here, but it's not, we're so focused on cancers and heart disease and blood sugar and right that we forget that at root here is stress and inflammation, right?
Absolutely. I remember
Oh,
the first time I saw, and this was actually years ago. Oh man, how Ashton would have been a baby. So maybe like 6 years ago, almost 7 years ago. And I had a doctor from the States that I had met, and we'd kind of done some stuff together. and he offered to do a hormone panel for me, the saliva panel, the whole thing for free as
Yeah.
part of the thing. He was doing this little study, and I'm like, great, no
Okay.
problem, I'll do it. And I just all I remember is getting this letter back from him, and then getting an email saying we should probably talk about your cortisol. And it was at the peak of my like business growing, and we were traveling all over Europe, and it was just probably the most stressful time of my life.
Sure.
And I went, okay, what? I don't even know what cortisol is. What is that?
Yeah. Yeah.
I just knew it in pertaining to birth, like labor. You know what happens to your cortisol in labor, and I'm like, all right, cool. What's going on? He's like, you pretty much are living like you're running from a pack of wolves.
Yeah.
And it goes,
Right.
you've been doing this for too long. My cortisol was off the charts. He goes, I don't even honestly know how you've survived this, this long.
Oh my God.
But again, it
Barely.
was one of those eye-opening moments where I started connecting dots, and I feel like I've never stopped since then.
Yeah.
I want to connect the dots. I want to know, why do my hormones do this when this is going on? What dictates what? Is it the
Yes.
chicken or the egg, right? Is it my
Yeah.
hormones that did this, or is it the stress that did my hormones, changed what my hormones are doing? All
Yes.
that whole processing. So I would want to know, like, what would you say in our practical day-to-day life? And you don't have to give us like foods and stuff if you don't want to go there, but what are some things that we can do on a maybe perimenopausal stage, as we're heading into that stage, that
Mhm.
can help us with this? Is there stuff we can
Absolutely.
do?
There's nothing I've actually had one female ask me what she can do to prevent perimenopause from starting, and there's nothing
No.
you can do to prevent it. The
Right.
other important piece, and you just briefly touched on it, is we're always looking at what are our hormones doing to us.
Yeah.
But really, we have to recognize what we're doing to our hormones,
Yes.
right? So perceptions of stress, our perception on a because there's certain stressors there's nothing you can do nothing about. There's a
Yeah.
lot of stressors you can do nothing about. They're happening, but our perception of that stress can largely change what our hormones are doing. And a stressed out female, a burnt out female will always do worse in perimenopause and menopause than a female who isn't.
Right.
So once you hit around the 40-year mark, the good news, I think, for a lot of us, we start to see a bit of a mind shift happening around 40, where we kind of recognize I'm 42, and even in the past 2 years, I can really start to recognize like I don't really
Yeah.
care for
Well, we come into
entertainment.
ourselves, right?
Yeah,
I
yeah,
always say, I wish I was 40 20 years ago.
right,
Right?
right.
I want the body of a 20-year-old, but I want the mind of a 40-year-old.
It's that estrogen.
Wouldn't that be great? Yeah,
Yeah,
no.
yeah, but I get that. So we really need to be as we approach those perimenopausal years, which can start as soon as they're around 38.
Yeah.
On average, it starts more like 45 and up, though, right? 38's early, but it's still considered normal within diagnostic ranges. We really want to check in around stress management, right? If you haven't seen a therapist, see one. Make sure you've got boundaries,
Yes.
right? Got some boundaries in place, social, at work. It doesn't matter within your family dynamic. Make sure you've got as much on your plate as you can handle, and that you're managing stress really, really well. That alone will ease you in. I also think the education piece is huge.
Yeah.
Understanding what is happening really keeps a lid on that sort of boiling pot, because you just said it, we can talk ourselves into very excessive and
Yeah.
extreme symptoms. So having full education around what's happening is really helpful, that insight piece,
Yeah.
right? Yes, diet. I don't. I'm not big on advocating for a diet with a name,
Same.
right?
I agree.
Make
Yeah.
sure you're eating protein, lots of veggies. Too much fruit never killed anyone,
Yeah.
and whole grains. You know what I mean? Like,
Yeah.
we're gonna keep things simple.
Eat real. Yeah.
Yeah.
Yep.
Of course, move your body. I do know, we do. There's tons of evidence. It's coming out of both the States and England, looking at exercise in perimenopausal and menopausal women. And the one type of exercise that is by far ahead of the rest is weight resistance.
Yes, my mom actually was telling me that because
Yeah,
she
it's
misses going to the
huge.
gym, and
Yes.
she's like, "I just need some little weights or something because I always
Yeah,
felt better when I was doing
yeah,
weights or using weights."
yes.
Yeah,
I feel like
interesting.
it's a female thing to think we gotta start running or
Yes, yeah,
right?
or
Where's
just
our cardio?
yoga.
Yeah,
Everyone I know is like, "I'm just gonna do," because it's the Zen side of things. Yoga's fantastic,
yes.
but
Yeah,
there's
you
still
need you
more.
want yes, you've gotta get that weight, the resistance type training that's gonna really feed the muscles, right?
Mm,
So, and I can't deny that kind of evidence.
right.
Um, does some perimenopause and menopausal, do some of them warrant no treatment? Yes and no. If there's no symptoms, you are really lucky. But what comes back into my brain there, so even a female who says to me, my last period was 15 months ago and I blinked and it was over, I have no symptoms.
Hmm,
Still my duty to say to her, yeah, but you're still at high risk of osteoporosis, heart disease, and
right,
Alzheimer's. And if you do any hormone replacement, that will reduce your risk of all three of those, right? So I still bring
got
that
it.
into the conversation because we know this,
Yeah. So what
right?
would that look like then? Let's say there's no major issues or maybe there's just some mild ones going on. What would that look like? Would it be, I'm just being super, general here. Would it be like a cream you rub on? Would it be a capsule
Yes.
you take once a day? How would that look?
Yep. So my prescription around bioidentical hormones, the estrogen is a cream. It is sourced from soy being phytoestrogenic. There are forms of soy and ways to utilize it that becomes zero estrogenic or it has more of a negative effect on the body.
Right.
Um, uh, this, extraction from soy is phytoestrogenic, meaning it mimics our estrogen hormone as much as the human hormone, as much as biologically possible. It is a cream. It's a topical
Okay.
transdermal form.
Yeah.
Progesterone is also sourced from yam, also as biologically identical to the human progesterone hormone as possible. It is also in a cream. When I get to some higher doses of estrogen or women who still have an intact uterus, we have to use, the study says that the topical progesterone isn't potent enough to protect the uterine lining from
Mm.
growing. So we have to switch them over to an oral or the vaginal suppository of the tablet
Which,
of
which
progesterone.
I'm quite familiar with.
Girl, you love
Oh
me.
boy.
Yeah, that one, that
Big
one.
friends.
Yep,
Yeah.
but it will protect the uterine lining.
Yeah.
And I don't typically have to stray from either of those. That's usually enough.
Interesting.
And we dose based on symptoms as well.
Yeah.
I have some colleagues who are asking, I'll have a mentor in here and they'll say, well, when do you test to see if you're doing it right? No, it's all subjective experience, right?
Right.
So if the female has no symptoms, she just needs a really low dose of both,
Okay.
right? If there are symptoms, we dose until we get rid of the symptoms. Then we hold for a little bit.
Right. Okay, so it's not just estrogen. You brought in progesterone there as well, and I wouldn't have thought of that. It's
Yeah.
that balance, right?
Yes, that's it. And you brought that up
Right.
earlier, is that estrogen dominance really just means that we have too much unopposed estrogen floating around in our body.
Right.
Progesterone is the hormone that opposes the estrogen. So
Okay.
estrogen, right? Estrogen is
Got
our proliferative hormone. It makes things grow,
right.
right? Progesterone is our suppressive, nurturing one. So estrogen is what builds our uterine lining before a period.
Yeah.
Progesterone is what keeps it at bay. So it's not like horribly bad, right? Well, at least we hope it's
Yeah.
not horribly bad. So women with a uterus, we have to give progesterone. I do see coming out of some medical doctors, if the female has had a hysterectomy with or without ovaries, so they may have ovaries, they may not, but as long as the uterus is gone, they will only dose the estrogen.
Hmm.
My approach there is that we have estrogen receptors everywhere, not
Yeah,
just in our uterus.
that's right.
So we will want to put progesterone in there as well, just to keep a lid on that proliferative action of the estrogen. So even if my female patients have had a hysterectomy, they will always get both.
Interesting.
Yeah.
That makes sense.
Mm,
'Cause you're
yeah.
right. Our hormone receptors are not just in one part of our body.
No.
They're
Mm,
responsible for all kinds of things around our body. It's
absolutely.
wild.
Even
Yeah.
breast tissue alone. It's just, again, it's an error on the side of caution. And it also will reduce. So when women start hormone replacement from estrogen, they can have transient breast tenderness, meaning in those first few weeks, we can
Right.
see some swelling and tenderness. If progesterone's playing a role, it's very minimal, if at all. Do I see that? So,
Yeah.
yeah.
What would you say? I'm going to finish with this because I could go on all day talking about this.
Yeah.
It's super fascinating.
Thank you.
What would you say, if there is any, and this might be a silly question, but it's what I'm thinking in my head. Is there anything you would say is a do not do this when it comes to, let's say you haven't had your period or you're recognizing at your age that you're going to be heading into this. What would be some, hey, pay attention, don't do this, or definitely do this?
Yeah. My biggest do not do is do not suffer.
Yeah,
Right? Don't
I agree.
don't don't suffer. You do not have to push through this. Even if you have a blood clot history or a history of blood clotting disorder, you've had breast cancer, there are also other things we can utilize. There are plants we can utilize safely, right? There is some homeopathic stuff that I find works like a charm on the women who aren't candidates here. Um, the biggest don't in perimenopause and menopause is don't suffer, right?
Yeah,
The
agreed.
biggest do is to look at your options. The biggest,
Yeah,
right? So reach out,
always.
step out,
Ask
talk
the
to.
questions.
Yes,
Yeah.
yes, and don't stay off the internet, right?
Don't Google.
No,
Oh
don't
my
do that.
gosh.
Don't
I
do
I have to tell myself that sometimes I'm guilty of it and I'll look something up and that's usually when I call my sister or
yeah.
my mom, the other women in your life, right? You're like, is this crazy that I think this? And they're like, no, I Googled the same thing. It's
So I remember
why do
doing
we do this to ourselves, right?
yeah, we're well, I mean, I can acknowledge and appreciate the need to get information.
Yeah.
It's a wonderful thing that it's self-empowering. Um, it's just a shame that the internet algorithm just takes you straight to death,
Yes,
right? Yeah,
every time. Like,
yeah,
you're trying to do that dot connecting, right? And it's
yeah.
well, the one of the reasons I do this in this podcast and have guests like you on is I want to connect people. I want to connect them to you. I want to connect them to the right person in their area, whatever it is.
Yeah.
Talk to a naturopath in your town, your city. Call Danielle. Set up an appointment. You do virtual appointments, right?
Yes, as long as the patient's in Ontario, it is yeah, yep, that's
It's
what
totally
COVID
worth it. Yeah.
yeah,
Yeah,
yeah, yeah,
it's just
yeah,
one of those things that we don't. You're like you said, we don't need to suffer with this. We don't need to, and also just running maybe to a family doctor all the time with a symptom and a symptom and a symptom that they're just band-aiding the symptoms because it's what they know to do for the
that's
most part.
that's right.
Whereas someone like yourself, I'd say you're going to look at it in a totally different way. So
It's just a different approach, yeah,
yeah,
it's a different model of medicine, and when they work together, magic happens, right?
I
Yeah,
love it.
yeah.
Well, thank you so much. This was so
No,
informative. I just learned a ton. I
amazing,
should
well,
have
thank you.
taken notes.
Oh,
I'll
that's
be, I'll
awesome.
just rewatch it and write things
Yeah.
down.
Well,
And
thank
then I'm
you
gonna
for
call my
having
girlfriends
me.
and say, "You need to listen to this episode."
Yes, this is a good one. This is a good
It's
one.
a good one, I promise. This one's a
Yeah,
good one.
that's
Well,
awesome.
we will talk some more. I know we'll have you on again. We've got lots of subjects that I'm sure we can cover on women's
Absolutely,
health, right?
absolutely, it's a big one.
Awesome. Well, thank you for being with us.
Yeah, thanks.
Would you like to learn more? Find me on Instagram and YouTube at Mom Days Podcast.